Joining me now to talk more about this dire circumstance, Dr. Jayne Morgan, Executive Director of Health and Community Education at Piedmont Healthcare, Inc., and Adjunct Associate Professor of Medicine at the Morehouse School of Medicine. Thank you. I'm thinking of the first responders right now who are seeing these injuries come in, from smoke inhalation to severe burns. How do you triage in a situation like this, treating the most critical first?
Absolutely. These are all questions that have to be managed when patients come to the emergency room. And certainly the burn patients, how severe those burns are. First, second, third degree burns, but also smoke inhalation. And we have to remember what that means, and not just acute smoke inhalation, but long-term smoke inhalation absolutely impacts health. And we have to begin to think about that as well. It not only exacerbates any respiratory diseases you may have, such as asthma or bronchitis, but it also increases your risk of heart disease and also puts you at risk at an increase for depression, dementia, and some types of cancer as well.
The immediate concern, though, if you're breathing in, and we're seeing some of these images, smoke over the course of minutes, even hours, that can quickly set in. What can people do right now if they haven't been able to avoid what's in the air?
Things that you can do is absolutely follow what your emergency advisors are telling you. If they're asking you to escape and to move out of that area, please do so. If they're asking you to stay put, make sure you can seal your windows, you can run air conditioning, and always, if you have access to it, try to make certain that your nose and mouth are sealed with a mask that's a well-fitted mask, an N95 mask or higher, to filter out some of this pollution and particulate matter.
Yeah, and the burn victims, these burns could be, we don't know at this point how severe, but burns can impact every part of the body. Talk about how you treat burns depending on the severity.
Yeah, absolutely. Burns can rapidly escalate. It creates a large volume of fluid loss from the body as well. And you can quickly go into shock and also sepsis. So absolutely, burns require absolutely emergent medical condition. The degree of the burn certainly increases your risk. If you are not able to reach any type of medical facility and you want to stay, you have to stay put, then make certain that you can manage and contain that as best as you can.
Yeah, and how do you advise people to stay calm in a situation like this? If you are dealing with severe critical injuries, you can't get to help right away, to communicate with one another, to keep your level of stress and panic down.
It is a stressful situation, and we see this very similarly with hurricanes as well. As hurricanes are approaching and people are deciding to stay in place, and that hurricane approaches and you are waiting that anticipation, and then the devastation and the aftermath. And this is very similar to that. And it is difficult to remain calm, but if you can, try to settle yourself down. Think about what types of provisions you will need, what types of medications you will need to have with you to survive for periods of time without infrastructure, including access to water, and how you might manage increased physical activity. Things that are normally easy for you may be more difficult. You may have to go outside and walk for a period of a distance just to find food or to access water or to bring in firewood. So remember to prepare for that increase in physical activity. Even after hurricanes and tornadoes, we see an increase in heart attacks shortly thereafter, within the first 7 to 10 days, because people are not anticipating what the aftermath will require in physical energy from you.
Right. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.